Managing pain can be difficult for people, especially with dangerous opioid medications making the headlines. But Integrated Pain Associates can help patients manage their pain and regain function. Here to tell us more about that is Dr. Scott Irvine. Thank you for joining us today.
Thank you for having us.
So first of all, tell us about Integrated Pain Associates and kind of what you guys offer to your patients.
I think pain awareness is the idea that patients have choices. You don't have to live with pain. You don't have to just take a Motrin or a Tylenol or hydrocodone to get better. We live in the area. We have doctors that live in the community, go to church in the community, and we feel like the old adage of having to grin and bear it is not something that we have to do anymore. And we have lots of options to help people feel better.
And you have more than one doctor. Obviously, you are one of them. How many doctors are in your practice?
In our practice as a total, we have 9. We have 2 that live here, and then we have some other locations, but a total of 9. And then we have 3 wonderful nurse practitioners that we have there as well.
Tell us where you are located at and kind of how that location came about for y'all to take over it.
Well, we had the wonderful opportunity to help Dr. Munton retire. He was a long-standing, well-respected physician, and he wanted to retire over at Ridgemont, and so he asked us to come and help him retire. So we had the opportunity to take over his practice, and that's where we are.
And so what type of patients are you seeing? Is it really just a wide range of pains and ailments?
Sure. We have knee pain, shoulder pain, back pain, neck pain, post-operative pain, pain from motor vehicle accidents. So there's nothing that we don't see, carpal tunnel, cubital tunnels, anything that really, if it hurts, we see it and try and figure out why it hurts. And if we can do something about it, we do. And if we can't do something about it, we refer you out to the appropriate specialist.
And so do you still have the office on Antley as well? Is there a clinic over there?
There is not.
No, so it's just over on Ridgemont,
yes,
correct?
Yes, it is.
And you guys took over that office there. And I know a lot of people are wondering, the Forge is still inside there as well, so you kind of guys are working in the same building there.
Well, yes, and we've taken a little bit of the Forge's space to create a location and to do procedures. Because some of the procedures require a significant sterile environment, you can't do them office-based. So we've taken a little bit of the Forge space and are expanding a little bit into their area.
And so what is your goal being here in Abilene and opening this clinic?
I think the idea of, I think for us, we get out of bed every morning and we get our buzz when we get to help people sleep better because they don't have to wake up from pain. They can go to the grocery store and get through a visit to the grocery store. They can cook a full meal at the stove. They don't have to live in the amount of discomfort that they may have been living in. And so for us, is if we can come and participate in advancing the community and making it a safer place with regard to pain, then that's a win.
And so how do we get an appointment with one of the doctors there? Is it physician referral, or can we just call the office and get an appointment?
Typically it's physician referral, and that's usually because of insurance requirements, but Medicare patients can just call the office, and Medicare requires no insurance approval.
Okay, and you've only been open in that new location, or new to you guys, since July 1st,
yes.
Correct? So not very long. How has it been so far? I mean, what is the patients, have you had a lot of patients coming in?
Yes, I think that we have a dedicated physician that is Dr. Ben Lowry. He's our education physician, and he advances us constantly. So everything we do is very cutting edge. Everything we do is very contemporary. And so a lot of the procedures and a lot of the things that we're bringing to the patients, the vertiflexes, the dorsal column stimulators, weren't initially present. And so being able to broaden the scope of opportunity for patients to feel better has been really rewarding.
All right, well, we appreciate you coming on today, sir.
Thank you.
And helping our people in Abilene be pain-free. If you want to contact Integrated Pain Associates, they are located at 4351 Ridgemont Drive. Give them a call at 795-1888. You can find them online at ipaclinic.com or search for them on Facebook.